everyone. This is Dr. Sophia Beecher, and thanks for joining us as we get to the truth of it. Today we have Dr. Caithlin Williams Beecher. She's an endodontist, and for all of you who missed the Smile Jamaica interview, that means that she is a root canal specialist. So she takes the nerves out of teeth to allow you to keep your teeth. So today we're going to talk about traumatic injuries to the teeth, and just a disclaimer, if you have any kind of trauma, you want to make sure that you are medically stable, so proceed to the nearest doctor or hospital before seeing the dentist or the endodontist, okay? So Dr. Williams Beecher, she is homegrown and she's internationally trained and board certified, and today she's going to help us through a very frightening experience, which is having a trauma to the teeth, and telling us what we can do in terms of options to try and keep the teeth. So let's see, I have a question list, I'm sorry. Number one, what are the most common types of trauma you see?
Okay, so depending on whether it's an adult or a child, the level of trauma tends to differ. In children, we see more luxation injuries where you may have displacement of the tooth without necessarily fracture of the tooth or the tooth coming out of the mouth or out of the jaw. And in adults, you most likely see injuries where you have fractures to the crown. In general, though, you do have different types of injuries that happen. The most common ones are the ones that people will be most aware of is, your tooth get knocked out of your head. So that's called avulsion. So your tooth is hit out, it's completely out, you're looking at crown to root, everything is in your hand. Other cases we have luxations, which may be to varying degrees, where the tooth is displaced, so it could be pushed forward, pushed back, pushed in, or it has extruded a little, so it's come down or come up further than where it usually is inside the socket. Or you may just have a simple concussion, as we call it, where you got hit on the tooth. There's really no displacement or anything, but you do have that discomfort to say, hey, I had an impact to the tooth. And other things include fractures of the crown or fractures of the root themselves. So it depends on the extent of the injury, the force at which the injury happened, that may determine the extent to which you may experience a particular trauma.
Sounds heavy, Doc. We need to go into more details about that.
Yes, we will.
Alright, so the first thing is, once a traumatic injury takes place, for you as a specialist, what are the most important details for the patient to remember, or for, if it's a little child, for the caregiver to remember to tell you?
Okay. So first of all, whenever the injury takes place, you have to assess whatever is happening. First things first is you need to make sure that there's no other medical emergency that is taking place that would supersede. As Dr. Beecher said before, if you are having any medical conditions or you're medically unstable, go to the nearest hospital or physician, have that stabilized first, and then you come to see us. If not, you come straight to see a dentist. It may not necessarily be me, the specialist, but once there's any injury to the mouth or to the teeth, see the nearest dentist as soon as possible. What you would come to us now is giving us basic details. When did this incident happen? What happened? What did you notice? What are the injuries that you see that has taken place? How long ago did this take place? Because sometimes you may not necessarily see us the minute it happens, or even a few hours after it happens. Sometimes we see you days after this happens because you're like, oh yeah, my tooth still hurts. Let me go to the dentist and see what's happening. No, you need to come as soon as you possibly can. The earlier you have an intervention done, is the better the outcome is for you at the end of the day.
Well, that answers my next question, certainly. So it doesn't, you're trying to tell me it doesn't really depend on the type of injury. Once you have a hit to the tooth that you can acknowledge, whoa, I got a hit to my tooth, I should go right away.
Yeah,
so,
have it assessed.
So, alright, so this is kind of two questions in one. What is, you said you'll have a better chance of saving your tooth if you go sooner, right? So let's say I get hit in my mouth, you know, and then I come to you, what can I expect during a trauma examination?
Alright, so when you come to the dentist, me or any other dentist, things that you should expect is that first of all, they're going to take a history from you. As I said before, they're going to want to know, when did this happen? How long ago? What was the circumstances around it? Were you in a motor vehicle accident? Did somebody decide to punch you in the mouth? Did you walk into a door? Did you fall down the stairs? The impact, where you hit it forward, to the side, anything like that. Did you hit your chin and all your teeth just went together? Each impact can cause a different extent to trauma that takes place, okay? So we want to know those details. Having gotten that, we're gonna do, you know, general assessments. So looking at the outside, do you have any cuts to the face, any cuts to the lip? Is there any swelling? Is there any active bleeding? Then we move to inside the mouth. What does the gum look like? Are we having bleeding gums? Is there cuts to the gums, damage to the gum? Is there anything that we need to suture, stitch back together, all of that? Moving on to your teeth, your bones. Teeth cracked or teeth displaced? Is your bite affected? Because sometimes depending on the injury, if the tooth position changes, it can change how you bite. You may be able to bite together, or in some cases your teeth can't meet any at all because there's that one or two teeth that have changed their position that cause your teeth not to be able to meet as they usually do. If there is fractures to the teeth, we have to locate, if you don't have those broken pieces in hand, where are they? Rule out whether or not they're in your cheek, in your tongue, in your lip. Did you swallow it? Only the Lord knows. Also, in other cases where the tooth completely came out of the socket or out of the bone, do you have the tooth? Yes. Great. Do you not have the tooth? No. Did you swallow it? Is it located in any soft tissue in your mouth? Or did you leave it at the scene where the incident happened? So these are things that we have to get through. But even before we get through to that, if it is a situation where you come to us immediately, there are things we have to rule out, such as, you know, concussions or any other cerebrovascular or CNS issues that you may be having. So that if there is anything of any immediate emergency outside of the dental, that we ship you right off to the hospital, because your overall health and your general well-being is also extremely important.
Okay. So let's simplify the last part a little bit, just in case they don't understand what you mean by cerebrovascular and all these things.
Your brain. We want to make sure that everything with your brain and your nerves, especially in that head and neck region, that all of that is okay. So, you know, we want to make sure you're not having any amnesia, which is forgetfulness of the incident. Oh yeah, I remember getting hit, but I don't remember anything after that. Nausea, vomiting, fluids coming from your nose or your ears. We don't want any of that. If we see anything like that, or if you notice anything like that happening with an individual that may have experienced trauma around you, get them to the nearest hospital immediately. No hesitation, no delay.
All right. You heard that Jamaican people like to procrastinate, no delay. Alright, so let's talk about the possible outcomes for broken tooth to start. Let's say it's a baby tooth and it's broken. What's the most likely thing that you would offer as a treatment versus a permanent tooth that's broken?
Okay, so for a baby tooth that's broken, or any tooth that's broken, it depends on the extent to which the tooth is broken. If we have a simple fracture, so it's just the enamel that's broken. So let me backtrack a little for those who may not know the various layers of the teeth. So in the tooth, you see these outside areas that you see when you look in the mirror? That's the enamel. That's the hardest structure, or one of the hardest structures in your body. Below that layer, we have what we call the denting. And then in the center of the tooth, we have the pulp chamber space, which has the nerve and the blood vessels, and that's what gives, the feeling and everything to the tooth. So we have enamel, then dentin, then the pulp tissue inside. Now the first level of fracture is if you just have a simple surface fracture to the enamel. So it's just within enamel, and we haven't gotten to dentin or anything like that yet. With cases like that, whether it's permanent or it's primary teeth, whether it's permanent or primary, if you have the tooth fragment, you can bond it back to the tooth structure, or you just build it up with some filling material as you would do with any other cavity that you have in the tooth. When we get to denting now, you will have to do what we call, a protective coverage of that area, especially the closer we get to the nerve and pulp tissues. And as we speak of that, one thing I forgot to say about examination is we do x-rays. Radiographs are very important because especially in cases like we're talking about, addressing a broken tooth, an x-ray also will give us an idea of how close does this fracture get to the pulp chamber space, and how close are we to these nerve and blood vessels that are inside the tooth. But outside of that, with the x-rays, it tells us, gives us a better idea, especially if the teeth are displaced, how far is it displaced from within the socket, the position in which it's displaced. If there is any missing fragments that may be in soft tissue, we can take x-rays of that as well to see if it is actually located in the soft tissues and rule out that you don't have a tooth fragment or a piece of bone or anything being lodged anywhere else inside your oral cavity. So moving back now to looking at what we call an enamel dentin fracture, we would do coverage of that dentin area with, for example, glass or enamel material, and then if you have the tooth fragment present, we would bond that back to your tooth, or we build it up with filling material or composite. Most times the one that matches your tooth color as best as possible. Where it starts to deviate or get a little tricky now in terms of baby teeth as opposed to adult teeth is when you have a fracture that exposes the pulp tissue on the inside of the tooth. Now for a baby tooth, we can do what we call a pulpotomy, which is we're removing the surface level of the pulp tissue, and we're going to put a lovely calcium-based filling material right on top of that, and then we build up the rest of the tooth. Or if you have the entire tooth fragment that we can bond back to the tooth, we will do that. In the adult teeth, a pulpotomy may work, primarily mostly for teeth that have an immature root, which means that the root hasn't completely formed yet and closed. In a tooth where, we call a mature tooth, where entire root structure has completely formed, we may need, depending on the extent of the injury, to move from a simple pulpotomy to full root canal treatment on the tooth. Okay?
All right, so Doc, just wanted to, and you did say that x-rays are extremely important. You see, especially with these baby teeth, let's say that the age of the child is very important, because if the child is 4 or 5
right,
and they hit out their tooth, that tooth is about to come out anyway. Or they break the tooth, they break the tooth, that tooth is about to come out anyway. So if it's a break that's close to the nerve, right, you may choose to just take that tooth out, right, instead of doing anything very fancy. All right, so we have come to the end of this section. Join us again very soon with the part 2. This one that we need a part 3.
Part 3.
Yeah, so come back, join us again soon for part 2 of our talk on trauma to teeth. Okay, thank you so much for joining.
Thank you guys. See you again.
Okay, broadcast.